didn't realize you guys are waiting for me. Okay. Good afternoon, everyone.
Afternoon.
Thank you for taking your time to come down to listen to the talk. Basically, as most of you would have realized, I'm the dentist. I'm going to stand up better.
Stand up.
Right. So better. Okay. Basically, this page is about the clinic that I'm working in. It's called Ara Dental Studio. Small, humble clinic in Oasis Ara Damansara. It's been operating since early this year. And yeah, these are the details about my clinic. We are on Facebook. We have a website, Ara Dental Studio. Go check us out. There are occasionally cool stuffs on our Facebook. Go like us. Sometimes they are free stuffs. Yeah. Alright, so a little bit about the clinic. So that's the clinic. It's a clinic with 3 surgeries. There are 3 dental chairs there. I have a hopefully comfortable waiting area. I'm trying to move away from that scary looking, sterile looking dental clinic where people go, they shudder in fear. So I'm trying to move away from that. Try to put in cool things inside, make people a bit more comfortable. We employ she's one of my first few early patients. Yeah, and we employ highly competent trained staff to manage our patients. These are my nephews and niece. All right, and basically I'm here today to give you a not disgusting presentation about your teeth. Now, as a dentist, one of my biggest challenges is not really doing very nice fillings. It's not really doing very beautiful crowns. One of my biggest challenges is actually to manage patients' fear. One of the biggest factor when people shy away from dentists is because of fear, right? And what I find is that the fear is almost always not because of the fear in the painful procedure. It's more towards the fear in not knowing what's happening. So my objective of sorts today is actually to desensitize all of you about everything to do in your mouth, so that when you know what's really happening, and if, touch wood, if it really happens, it's not that scary actually. Alright? So, first things first, first impressions are everything. If you realize, the first thing when you look at a person's face, the first time you notice their teeth. Alright? And if you look at this example, straight away you can see already there's something stuck there. Right? This example, oh my goodness, ada chili dekat gigi. There's something on the teeth, alright? And if you look at this, again, it's the first thing you see.
Why always guy?
If they put girls, they're like, malu ma. So, if you look properly, these 3 pictures, if you go back, if you look at it, this guy actually doesn't have an ear. You didn't realize, right? You sure? Alright, kind man in grey shirt. What's wrong with this picture? Yeah, this woman has 3 hands. Alright? That guy should be running away instead of worrying the stuff stuck on his teeth. And the last picture?
Finger.
Yeah, she has an extra finger. Oh, I was blocking it. Yeah, so she has 6 fingers. So basically the point of all these pictures is actually a very cool picture that's done by Colgate. I actually stole it from there. So what they're trying to say is that first impression is everything. When you look at a person, you always realize the teeth first. You don't realize anything else. You don't realize what kind of phone they're carrying. You just realize, oh, there's something in the teeth. Should I tell them or should I not tell them? So, alright? So first impressions, research, blah blah blah. First impressions are everything. They find that people with straight teeth are perceived as more successful, perceived as smarter, and perceived to potentially have more dates. So single people out there, yeah. Right? So this is the gist of the research lasting impression. Straight teeth equals to success, love at first sight, crooked teeth, dull social life. Well, to be fair, this is a little bit biased. So I'm just trying to make a point that it's very important to have, it doesn't mean that you need to have really straight teeth, clean looking teeth, free of any problems, painless. Usually they are good enough, considered good teeth already. Alright? So what kills first impressions in terms of your teeth, alright? Not body odor and things like that, alright? What kills first I hope I don't touch any raw nerves. Okay, anyway. First impressions, what kills it in dentally, these are the common things: dental caries, infection, gum disease, dead tooth, fracture, tooth can break as well, like bones, staining of your teeth, and halitosis. what is halitosis? I'll talk to you about this later. So basically, let's talk about tooth first. A single tooth, the outermost layer, the white color is called enamel, the middle layer is called dentin, and right at the center, it's the nerves, the pulp, the nerves and the blood vessels. And if you look at the bottom of the tooth, at the tip, that's the lifeline of the tooth. The tooth is alive because of the pulp, because of the nerves. Alright? The tooth is being held by bone, and above it is being held by your gums. Alright? The fleshy part is your gums, underneath it is your bone. So this is what's holding on to your teeth. Okay? So, what is the main cause of common dental problems? There's only one big cause. Alright? Common dental problems like infection, decay, pain, things like that. There's only one culprit, and it's dental plaque. And this is the one that we need to always constantly remove all the time. And that's where brushing comes in. Okay? What's dental plaque? If you realize after you have your meal, in a matter of minutes, you realize there's this yellowy, gooey material that's stuck onto your teeth. And that's the one that contains bacteria. And if you look at this picture on the right, that's an illustration. Bacteria are not that colorful. There's hundreds of bacteria in your mouth. And when food comes in, they're very, very happy because that's where they use up all the food. Okay? And this is the tooth surface, and they start to form this vibrant looking condominium there, growing in number and growing in the mouth. Okay? And they keep replicating. And when you brush your teeth, people always ask you to brush your teeth because you want to remove all these. Alright? We have this very cool little we look scarier here. Alright, warning, more pictures might look scarier here later. So we have this little exercise that we do in the clinic and sometimes in dental school. We get patients to chew onto these pink colored tablets, and these tablets tend to stain your plaque. So if you look at this fella, has a lot of plaque actually. You can't see it in your mouth, but when you stain it, you can see it's actually quite significant. And that one, that's the real deal. Those are bacteria in your mouth from very, very powerful microscopes. So you can see these are all the bacteria there. Alright? It's supposed to be a surface of your tooth, but it's covered by bacteria. Alright? So let's talk about caries. Number one, what's caries? Can anybody tell me? Basically, it's gigi lubang lah. Sudah rosak. I mean, Dr. Gigi saya sudah lubang, meaning there's caries. Alright? There's a hole in my teeth. It's caries. Caries, simply put, is decay. Alright? How do people get decay? Food gets stuck on the teeth surface. You don't remove it, you don't brush it. Bacteria uses the food as food, and then they produce acid. And that's the one that eats into your teeth. And that's the one that causes decay. Alright? Very simple, very basic. So once you eliminate that by brushing, once you eliminate plaque, you won't get all these. Alright? So, yeah, it looks scarier, huh? I was trying to find pictures that are not so scary, so it doesn't scare people. I see some faces like, oh my god. It gets scarier. Okay, anyway. So, these are examples of decay, alright? Can you imagine our teeth, the minerals of our teeth, they are one of the strongest in the world. And for us dentists to cut teeth, we need to use a drill that's coated with diamond. Alright, so it's very, very strong. But for bacteria to just produce this simple acid, they could eat up all your teeth already. Alright, that's where you get decay. And it's not necessarily only in your front teeth, it goes everywhere else as well. Right? What can be done? Very simple, bread and butter work. Dental fillings. Alright, that's a cavity. Do fillings. And nowadays, fillings are highly aesthetic. When we do fillings, they look very, very close to your natural teeth, like these. People can't tell that they are fillings. Sometimes patients come in and say, Doctor, I've done a couple of fillings before. Like, where? I can't see. Because it looks very, very close to your teeth. So nowadays, fillings are tremendously strong and very, very aesthetic. Alright? I'm sure you have seen black metal fillings before. Yes, they are available there in the market as well. But nowadays, we tend to move away from these black metal fillings because they are, one, they're not very aesthetic. And secondly, they are very, very strong, tremendously strong. But sometimes to a point where it might break teeth. So it might it's sometimes a bit detrimental to your teeth as well. So we tend to do these kind of fillings nowadays, the ones that look like your natural teeth. Secondly, gum disease. Remember gums, the ones that are holding your teeth. When we talk about gums, we talk about the soft, pinkish, fleshy areas that are holding your teeth, as well as bone. Okay? So bacteria, sometimes they hide underneath your gums. If you realize, if people who use toothpick, sometimes you you shouldn't be using toothpicks. If you would have realized that between your teeth and your gums there's always a little space. And that's a natural space. There should be a space there. Okay? A normal healthy space is about 1 to 2 millimeters. So if you take a ruler and stick it in there, it should be about 1 to 2 millimeters. But you shouldn't laugh because yeah, dirty. Let me stick it in. Okay, anyway, it doesn't sound right. Okay, anyway. Moving on. So bacteria, they go underneath the gums, and again, they use up your food and they produce acids as well, and toxic materials. And the gums then become swollen and they bleed very easily. So if you brush your teeth and sometimes you find that there's occasional bleeding, that's not because you are brushing too vigorously. It can be that, but most of the time it's because of gum swelling. The gums become a bit swollen. And over time, the gums, because they get irritated, they tend to move away from your teeth. Alright? And eventually, the gums are what's holding your teeth. If it's moving away from your teeth, eventually your teeth will become mobile, they become shaky. So it's a bit of a shame because some people, they come in, they have perfectly good, clean, good, healthy teeth, not necessarily clean, but they get mobile teeth. It's because the gums are failing them. It's because of bacteria. Again, bacteria. Alright? So, this is an example of a very mild gum disease. You get plaque, and you get, this is what I call gingivitis. Not because the person eats a lot of ginger, it's not that. It's because the gums are swollen. Alright, they are red. So if you get bleeding when you brush, most of the time it's because of these. And this is an example of a severe gum disease. Very, very significant. If you look at this, when I look at this, I always, it's a little bit too late already. Most likely, majority of these at the bottom have to be extracted already.
Extracted?
Because they are very mobile. You see the gums? Alright, if you look right, the gums, I just follow my fingers, the gums are supposed to follow this level. That's normal healthy gums. And that's how much it has gone down. And you see all the plaque there? That's all plaque. That's plaque. That's all plaque. It's so nice to do this after lunch. Oh my goodness. Alright, so yeah, this is severe gum disease, alright? Most of the time we see them in older people. A lot of factors. Sometimes as a person gets older, it's a bit harder to brush, a bit harder to clean, things like that. But surprisingly nowadays, young urban folks tend to have a lot of these as well. Busy, don't have time to, oh, you know what, I came off my toilet just now, I saw this toothbrush and toothpaste. It's very, very cool. Keep doing that, alright? Because it's very debilitating. When you lose your teeth, you cannot eat. Alright? It's one matter where it doesn't look pleasant, where you don't want to smile, but if you can't eat, you die. Right? So basically, gum disease is very debilitating. Alright? So, tatar. What are tatars? Tatars, in Malay we call it karang gigi. Tatars are plaque. Plaque are naturally soft. It's easy to brush off, but when you don't really... She's checking her teeth. Okay. So basically when the plaque is there for a very long time, our saliva actually contains a lot of calcium. And this calcium tends to stick onto the plaque and they become hard, like rock. So when it comes to this point, when you brush, no matter how hard you brush, it's never going to come off. Alright? And when it's like that, it's only going to stay there, it's only going to irritate your gums more. And the gums are just going to go away from it even more. Alright? So eventually, patients will get things like this, long teeth. Now if you look at that, that has been cleaned already. That's a perfectly clean teeth. I'm sure previously there's a lot of plaque, there's a lot of tartar there. And as a result of that, you see, if not right, this person actually has very good teeth. Nice, straight, fairly clean teeth, but boom, gum disease. Look at that. That's all the tartar sticking there. Alright? So people come with these long appearances. I've seen one actually last Saturday. Very nice, young, 24-year-old lady. Long tooth. Very young. Alright? And down the road, average lifespan, say 70 years, you have, what, 40, 50 years living with a tooth like that. And I told her eventually, maybe in 4 to 5 years time, the tooth is just going to fail. Alright? So you really, really need to take care. What can be done? As a method of prevention, scaling and polishing. Basically, scaling is a process where we remove all the tartar. Polishing is where we remove all the stains. So if you drink a lot of coffee, you drink a lot of tea, if you smoke, you drink a lot of red wine, if you vape, you get all these stains. And stains is the one where we can remove by polishing. If you go to see any dentist, And if they do scaling without doing any polishing, you're being ripped off. They should do polishing for you. It should be together. Alright? It should come hand in hand. It shouldn't be a separate thing. Alright? Dental infection. What happens is that when the cavity carries, it goes deeper, it goes into the nerve of the tooth. Alright? And it starts to form pus. It goes into your pulp, it starts to form pus. Alright? And usually these patients will come with severe, intense pain. This deep throbbing, you can't sleep at night, nothing works, painkiller doesn't work. Usually it's infection already. Alright? This, when it comes to this, it's a point of no return. Alright? It's already something very, very significant. Severe cases, patients sometimes come in with very big swelling on the face. That's because the pus is so significant that it goes to the sides of the face. Alright? Yeah, example. Caries. I don't know why there's no S, probably French. So there's cavity there. Thank you for humoring me, my friend. And then it goes deeper, and it goes into the nerves, and then it starts to form abscess. Abscess is basically pus. Okay? And pus, once it goes down here, it starts to travel further. That's why you see people start to get swelling on the face. Alright? Now, there you go. It starts to move away. And you see that little balloon there. Alright? The way to manage this, usually patients will come with intense pain. And what we normally do to relieve the pain almost immediately is actually to relieve that balloon. Alright? I'll just stop there. Now, what can be done? Long-term solution, it will be either a root canal or an extraction. A root canal, essentially, that's an infected tooth with pus, with abscess inside. Essentially, we have to go into the nerves of the tooth, clean up everything and do a filling there. Alright? It's major work. Usually patients have to come a few times to complete. Alright? So, try to avoid going down this path. Basically, try to avoid caries. Or like the French say, carie. Avoid those. Okay? And sometimes patients shy away from this, sometimes because they're a bit afraid of doing this. And sometimes it's a cost. Root canal can be a bit costly. And then they go for extraction. And once you go for extraction, you lose that tooth. That's it. You don't have a tooth there anymore. Nothing's going to grow anymore. Alright? Dead tooth. Sometimes the constant assault of bacteria within the nerves of the tooth causes the nerve and the blood supply, the lifeline, the whole thing dies. Alright? Sometimes it can be because of trauma. Sometimes when a person is young, they fall, they knock. There's a knock on the tooth. And then the lifeline underneath the tooth breaks. And the tooth dies off. Okay? And the tooth will slowly change in color, usually to dull grey, green, or black. Example, that. Alright? Everything else is okay. This one macam lampu tak on. Right? That's because the tooth is already dead. Okay? This is another example, it's a bit yellower. So, cases like this, same thing. A root canal. Basically, you remove the nerves and everything, clean up everything, because inside is dead. When the inside is dead, it's empty. If we leave it empty, bacteria will go in. So to stop bacteria from going in, root canal treatment is where we fill up the entire space within, so bacteria can't go in. And then how to change the look of this, change the aesthetics of this, then we'll do a crown. And that's a crown. A crown is actually a fake tooth that covers that tooth, so it masks everything. So when this is done, you can't tell that there used to be a fake tooth. Alright? Tooth fracture. Alright? Sometimes a person comes, hey, why you look so dirt, ma? Oh, I broke my tooth. Alright? So this can happen to... Thank you very much. Especially for children. Most of the time, children with buck teeth. You see them with teeth sticking out? Alright? They have a higher possibility of getting this. Sometimes dog pounds and it breaks. With cases like this, it's actually very simple. If it's not very deep, if it's only on the superficial level, not into the nerves, you just do a simple filling and that's it. And like I said earlier, our fillings are tremendously aesthetic, tremendously strong. A simple filling like that will just do the trick already. Very, very simple. 30-minute work and it's done. Okay? So, sometimes there are cases where it's too deep, it's gone into the nerves already. The moment it goes into the nerve, that's it. You do a root canal, you do a crown, or an extraction. But most people don't want to extract because it's a front tooth. The dirt becomes derpier, right? So, it's a good day, I'm having a roll now. Okay, teeth staining. We're talking about external stains. Stains can come from anywhere, cigarettes, in the mouth, coffee, tea. That's why they put it in a mouthwash. Alright? If you use a mouthwash with chlorhexidine, it's very, very good in the sense that it kills a lot of bacteria. The problem with chlorhexidine is usually a dentist will always advise patients to use it only for 2 weeks and not more. If you use more than 2 weeks, stains will come. The teeth will appear brown in color. But it's not because it's dead or what, it's just that it becomes dirty by the chlorhexidine. And that's it. Alright? So avoid using it for more than 2 weeks. And another side effect of chlorhexidine is it alters your taste. So if you go and eat this food and you find that the taste is like that, and then you use this and you eat again, it tastes a bit different. It's because of that. Alright? Nothing more than 2 weeks. Okay? So that's an example of staining. That's most probably cigarette. Alright? Cigarette smoking, the staining is almost always on the inside. Okay? Very easy. Another example. I actually have a patient, this white guy, comes to see me every 3 months. When he comes, I can't see the whites of his teeth at all. Wow. He has everything. He has smoking, he drinks tea, he drinks coffee, he drinks a lot of red wine almost every day. And it's all stained. So I have to see him every 3 months to clean up for him. Alright? So what can be done is, again, scaling and polishing. Alright? Stains, no stain. Alright? And another fact is, tobacco staining is actually one of the most intense staining in the mouth. It's very, very hard to remove. Very, very hard. Alright? It can be done, but it's very, very tricky. Halitosis. Halitosis is actually bad breath. Alright? Simple as that. What causes halitosis is one, poor oral hygiene. When you get a lot of plaque, when you get a lot of karang gigi, a lot of tartar in your mouth, it harbors a lot of bacteria. That's going to smell, definitely. Alright? Diet, sometimes people like to eat things like petai, things like that. Don't eat petai when you see a dentist. It's not nice. It's never nice. Or durians. Never nice. Okay. Cigarette smoking, definitely. And this is another one, salivary flow. Sometimes some people appear to have a very slow amount of saliva, like what you have now, saliva, correct? Some people, they have very dry mouth because the salivary gland are not active enough. And because of that, your food gets stagnant inside. It doesn't get washed off, so you get bad breath. Okay? What can be done? First, you need to identify the cause. What causes it? Quit smoking if you can, hopefully. Fillings. Sometimes there are cavities, and cavities harbor food, and then it smells. So fillings. Change your diet. Again, scaling and polishing. Alright? And basically, I've been talking about scaling and polishing, fillings, root canal, crown. Treatment is actually quite straightforward. It's the same thing. As long as we manage the bacteria, we manage the problem. So you guys as common public, the strategy is to control your bacteria in the mouth. We definitely have bacteria even now. It's impossible to have a perfectly sterile mouth, zero bacteria, impossible. The challenge is actually to maintain it at a manageable amount so that it doesn't cause disease. Alright, that's the key. Cigarette smoking. It causes a lot of problems. Gum disease, bad breath, teeth staining, and mouth cancer. Never pleasant, alright? There are a lot of cases of mouth cancer out there. Majority of the times it's because of cigarette smoking, and as well as bitter quid. Chewing tobacco, that's one. The other one is sirih. Bitter quid. Alright? So that's the one that causes cancer as well. And usually when you get cancers in the mouth, when it starts, it's very aggressive. It's almost always very aggressive. Because the mouth has a lot of blood vessels. So cancer can move around very fast everywhere else. Okay? Alright? So let's talk about prevention. Again, for everybody, it doesn't always have to be a complex dental treatment. All of these can be prevented. Alright? And how do you prevent it? Well, this is more important first. Alright? Good oral hygiene. Be motivated. Be meticulous. Be compliant. Meaning tell yourself you need to brush better. And it's just a simple matter of getting a right toothbrush, a right toothpaste. If you brush well twice a day, if you can reduce the amount of bacteria, you don't have to spend so much doing all these expensive dental treatments. Alright, that's the key. Fluoridated toothpaste, very, very important. Your normal over-the-counter Colgate, Dali, Sensodyne, whatnot, they already have fluoride. The ones that I'm always concerned about are those organic ones, those that you never always see on the counter. Check. Make sure they have fluoride. Sometimes they don't say we have fluoride. Sometimes there's something fluoro, something. As long as you have fluoro there, then it's fine. Alright, then there's fluoride already. And consume less sugar. Alright, sugars is the one that bacteria love the most. Okay? And floss. Try to floss as often as you can. Normally, I tend to advise to floss at least once a day. But even me, myself, I floss about once or twice a week. So, you don't really... Okay.
It's good enough, right?
It's good enough. Yes.
There's also like a claim that fluoride is a cancer-causing ingredient.
Right.
That's why there's a lot of organic toothpaste out there. So
Correct.
what's your view on this?
I disagree. Basically, there is now these two schools of thoughts. The ones for fluoride, the ones against fluoride, is like Brexit, things like that. So, Remain and Brexit. So basically, what I believe is that a little bit about fluoride. Now, fluoride is actually what they found in fluoride is our teeth, the minerals of our teeth, contains calcium and phosphate. And this calcium and phosphate will then go onto your teeth and becomes the mineral of your teeth. What fluoride does is that fluoride, once it's incorporated into your teeth, will combine into the calcium and the phosphate and in turn strengthens teeth. What it does is that when fluoride gets into the calcium and the phosphate, acids tend to take a bit harder to erode. That's the science behind it. Fluoride is also found to reduce the effectiveness, is to reduce the activity of bacteria. All the bacteria in your mouth, when there's fluoride, the bacteria gets a little bit, like a bit drugged, a bit high a bit. So they're not so active. Alright? Fluoride is one of the best public health methods to control dental diseases. That's why, probably a lot of you don't realize this, our waters are fluoridated. Alright? There are states in Malaysia with no public health fluoride, namely Kelantan and Sabah. These two states, Kelantan and Sabah, has one of the high decay rate in children, high dental caries rate in children. So fluoride, the amount of fluoride in our toothpaste and in our water is not high enough to actually be cancer causing at this point of time. Alright? So irregardless of how people keep asking me, fluoride good or bad, this is always my answer lah. Because it the evidence is really out there already lah. It's really helpful. Alright? So floss, if you can, there are two types of floss, wax and unwaxed. Those who never floss before, if you want to try flossing, try the unwaxed, because the waxed ones are very slippery. So if you don't have the dexterity, you might injure your gums more. Once you get the dexterity, then use the one that's waxed, then it's a bit better. Alright? Visit the dentist twice a year. Regular checkup actually allows early detection. If you see a decay, if you visit a dentist regularly, if there is a decay, the decay will be most likely detected when it's small, and simple fillings will do. And early detection means simpler treatment. Simpler treatment means lesser cost. If you wait for long, if you let it harvest, over time, it's going to only get more complex. It's only going to get more challenging. Alright? For both the patients and the dentist. Alright? And I've been scouring the internet for best pictures for toothbrushing, and I find that this is the best. And this is what I always tell my patients. Alright? When you brush your teeth, first picture, most important, the bristles of your brush, always angle it starting from your gums. From your gums, away. Got it? Even from the bottom, from the gums, away. A lot of people do left, right, left, right, left, right. What happens is when you do left, right, you have the cleanest center portion of your teeth. Alright? Very clean. But what happens is that you're pushing the plug into your gums. Alright? So starting from gums, away. If you do up, down, you are also pushing it into your gums. We are worried that the bacteria and the plug gets pushed into the little space of your gums. Now, a little bit about that little space. Like I told you, 1 to 2 millimeter of natural space between your tooth and your gums. Anything more than 2 millimeters is considered gum disease. Alright? In cases like long teeth, just now, we have this term called a gum pocket. Some patients will come in, you see, we have this little ruler that we use to measure, and we put it in and it drops in. And it goes about 8 millimeters. So that's actually gum disease really. It's no longer holding onto your teeth. Alright? So, first picture is the most important. Alright? That's how you angle it. If it's the bottom, from the gum goes up. If it's from the top, terbalik, alright? From the gum goes down. Okay? In the front, angle it straight. Got it? If you angle it like that, there's no way that big bulky head is going to go and clean all those areas. Straight. Got it? Yep. Alright, excellent. Now, a little bit about bruxism. I just added this yesterday because I realized I've been seeing a lot of patients with this. What's bruxism? Any guess? Answer's there. It's actually too fast. Okay. It's actually involuntary or habitual grinding or clenching of your teeth, normally during sleep. Alright? Usually people will notice that they wake up with very tired muscles because at night, whole night they are sawing their teeth. Alright? It's almost associated with stress. The old school of thought is it's always stress. So dentists will say, are you stressed? Most of the time, yes. Patients say, yes, they're stressed. Sometimes it's quite interesting. We ask patients, how long have you been grinding? Some of them, they say, I've been grinding for years. Some, they say, I've only realized I started grinding 3 months ago. Then when we probe further, has there been any change in your life? New job? Or something, you just got married, something like that. Then they say, oh yeah, there is, I just got a new project, something like that. Then that tells you that's stress, okay? And nowadays, there's an emerging school of thought, sleep disorders. There's this thing called sleep apnea, a little bit flabby at the back of your throat. When you fall back and you sleep, it actually covers your airway, and because of that, people can't breathe. And as a coping mechanism, they tend to grind. That's an emerging mindset about what causes bruxism. And surprisingly nowadays, if we suspect patient has sleep apnea, we can refer patients to Putrajaya. There's a clinic there, which is called a sleep clinic. It's kind of cool. You go visit them to sleep, right? So basically, they put you to sleep. They monitor your sleep, and if they truly diagnose you with sleep apnea, they'll fit you with a device to prevent that blockage. And what they found is that people who grind with sleep apnea, once they stop the sleep apnea, the grinding stops. Alright, so that's an emerging belief nowadays. So what can happen with bruxism is your enamel gets worn out, flattened, and sometimes it goes all the way into the dentine. That's a real life example. Alright, grind until nothing really, almost gone. And cases like this, right, and I don't know this patient, I got this from the internet, but chances are this is a very young patient. And this kind of patient will always appear older because when they have lost the height of teeth, the height here becomes shorter. So they look like that. So they look older. Alright? That one, can you see? I'm not sure if you can see it. Crack lines. Alright? So these are examples of, because the teeth are constantly working at night, there's no protective mechanism. So the teeth start to crack. Alright? And that one, split. The whole tooth is split. Cases like this, you can't do anything already. You have to extract the tooth. Gone already. Alright? So these are the effects of bruxism. What we do is we provide mouth guards. Now, mouth guards do not stop grinding. Alright? They don't. But what they do is they minimize the damage. So they're actually custom made according to the shapes of the teeth. And when you grind at night, you grind onto that plastic. So it protects your teeth. Okay? So basically these are some of the common things that I normally see in the clinic. What I'm going now to show you now are real case examples. These are my patients. Some interesting cases, just so you have an idea of what I'm doing. This would be substituting dentures with a permanent solution. I got this man. This is the model of that man. This is not the man. He's a dato actually. He's been wearing denture for I think very long. I think about 30 years really. And he told me I'm sick of wearing dentures. I have to remove it every night. When the moment I remove it, my lip fall back. My wife run away. So that don't happen. Okay. So basically he wants something that's fixed. Alright? and evaluated, and we provided him a bridge. A bridge essentially is like a crown. A crown caps a tooth. What we do is we shave this tooth, we shave that tooth, and then we link everything as a fixed tooth. So that's how it looks like when it comes back from the lab. All right, and that's how it looks like in the mouth. All right, so it looks, from without denture or without anything. Usually when there's no support there, the lips will collapse inwards, so people look older. All right, so when you provide this, provides that support, and it's aesthetically pleasing as well. He's older. If you realize the teeth are yellower, all right, I think he's in his 70s, and again you do see a little bit of tartar, yeah, but he did his scaling already after. Second case, I like this a lot. I like to do a lot of these. This is what we call a minimally invasive aesthetic. Minimally invasive meaning I don't cut a lot, I don't damage a lot of teeth, I don't do major work. It's just very simple. Microabrasion. What is microabrasion? Now, look at this. This is a 12-year-old girl. She has brown spots on her teeth. It's very, very unsightly. Remember I was talking about staining just now? Those are called external stains from your food, from your diet. This is actually internal stains. If you're a child, okay, of course you are no longer a child. If you know of children who are growing around the age of 7 and below, when they brush their teeth, make sure they don't swallow their toothpaste, because then the teeth will start to appear brown. Get them to spit. If they can't spit, then use a non-fluoridated toothpaste. Alright? Now, this one, the mother was very concerned. So what we have to do is, actually there's nothing much, it's very simple. When we do microabrasion, that's after. Alright? It's a bit of improvement already. What we do is we actually take a bit of acid, very light acid, and we take a bit of pumice. Pumice is actually like sand, and then we just polish the teeth slowly. It's like smoothing wood. Alright? And eventually it becomes a bit lighter. Alright? And I like to do a lot of this because it's very, very minimally invasive. It's very conservative. I don't cut, I don't do anything. Alright? Last. This is major aesthetic work. Alright? Very young, 20-ish, came in with this. We always see grade a person's teeth with colors. It's like a palette, and this palette is A3. So she's not very happy with her teeth because she says that the shapes are a bit disproportionate. This is shorter than that, this is wider. It's a lot of white spots because she did braces before. Yeah, it's white spots. Alright? And then she did whitening, so we did whitening for her. It doesn't look whiter here. It is whiter there. Okay? So it becomes A2, it improves a little bit. Alright? And then we did veneers. Alright? So veneers is where the front surface of the teeth, we shave them off a little bit. Okay? And we take a mold of it, send to the lab. And this is actually a temporary veneer lah. The temporary veneer actually we make according to the shape of the original teeth. So that's why you still see shorter, wider, original. So this is the veneers, beautiful ceramic veneers that came from the lab. Alright? And that's the final result. Alright? So we cement with a permanent cement, and we change the shape and we change the color, the shade. So that's with natural lighting, and that's with our dental chair light lah. So if you see the before and after, significant major dental work. Alright? And patient's happy. I'm happy at the end. So that's it. Alright? Thank you for surviving thus far. Thank you. Any questions? Yes.
Yeah. So just out of curiosity, before fluoride was used on wide public scale, what did people use before to take care of dental hygiene? Because not only we hear about cancer, but we hear fluoride also affects brain development, especially in children. So what?
Not really. To be fair, fluoride actually doesn't really cause any hindrance in brain development.
Yeah.
To answer your question, prior to using fluoride,
Yeah.
there is actually no specific active chemicals in the toothpaste that can arrest decay or stop decay. Previously, a toothpaste only works as an abrasive material.
Okay.
Alright? They just make it a little bit rougher and abrasive enough to brush off plaque. And to be fair, toothpaste nowadays are also a bit abrasive. They added fluoride as an added value to chemically improve its effectiveness. That's it. Yeah? Okay. Anything else? Now, halitosis commonly because of bacteria. Bacteria using our food. Alright? If you change your diet from very high sugar diets, refined sugar, processed sugars, to if you move away from that, the bad breath will reduce significantly. If there's a lot of plaque inside, if there's a lot of bacteria, plaque and tartar inside, even if you change your diet, the halitosis is not going to change so much. Basically because there's a lot harboring there already. But if you change your diet and couple with removing all these tartars and calculus and whatnot, usually the change is significant. Usually after scaling and polishing, normally patients who sit on the chair, sometimes with halitosis, I can tell already. When I sit there, I say, hello, okay, there's halitosis. So, immediately after we do scaling, alright, there's immediate change. It goes off immediately. And once, with that, coupled with your change of diet, when you reduce your sugar foods, usually it changes, like it goes off.
But what about those who have low saliva?
That's one as well. People with low saliva, unfortunately, there's not much. One that people recommend normally is saliva substitutes or some special chewing gum. There is that in the market. Usually, dentists will recommend patients salivary substitutes. Sometimes there's also medications. Because salivary flow sometimes is because one of the salivary glands do not have enough special chemical inside to stimulate the saliva to come out. So sometimes some dentists will prescribe medications to replace these chemicals that are not there to increase the salivary flow. But sometimes it can be also a simple matter of a blocked duct because of stones or something like that. If it's a blocked duct, then it has to be a surgery to remove the stone. So it all depends on what causes it actually. I've known of a lady who has this syndrome. It's called Sjogren's. You can go look it up. Low salivary flow. And she came in not really with halitosis. She doesn't have halitosis. She's aware that she has low salivary flow, but and she's very, very motivated. So in her mouth, she rarely has any calculus at all, any tartar at all. Alright? Clean. But she has a lot of decay. Because the saliva cannot wash out all the plaque. So the plaque becomes stagnant. Alright? So that's another thing as well. I did recommend her salivary substitute, but she hasn't gotten it back to me yet. So, yeah. Anything else? Yes?
What about xylitol?
Xylitol is actually sugar substitutes. Yes, it works. Bacteria, they still use a bit of it. Not as much, not as fervently as normal sugars. Yes, you can use it. Xylitol as a replacement to sugars, is it?
No, like in toothpaste or chewing gum or...
It's fine. The reason why people use xylitol nowadays is because the effect of them to cause caries is much lower. It still can, but it's much lower. But one thing though, it causes flatulence. Kentut banyak. Yeah. Causes flatulence lah. That's one of the side effects of xylitol. Yeah.
How effective is mouthwash?
This is my standard advice to patients. If you can brush well, you don't need to use mouthwash. Mouthwash actually acts as an adjunct to supplement what you can't reach. So if you are young, you are dexterous, you have access to good toothbrush and toothpaste, you don't need mouthwash. Older people, some people with disabilities, they can't brush properly, mouthwash helps. Other than that, not really. Oh, a bit about toothbrush. Common questions, what are the best toothbrush around? To be fair, the best toothbrush around is toothbrush that's soft and has a small head. That's it. It doesn't matter what brand. You can go to the pasar malam on the floor, they sell a RM2 one. If that has a small head and it's soft, it's good enough.
What do you mean small head?
The kepala, the one that holds the bristles. Yeah, when it's small, it's better because it reaches to all the areas. Some patients with high decay risk, sometimes I recommend them to use children's toothbrush because it's smaller. Alright, some of them has crowding. Alright, children's toothbrush is better.
What about the dual level?
The zigzag one.
XX.
Marketing.
Marketing.
Electric one?
0.02 electric. Okay, interesting. Research has found that electric toothbrush and manual toothbrush does not increase any brushing effectiveness. What it does, it doesn't increase the effectiveness of moving plug. What it does increase though is motivation. It's like, motivation.
What is the recommended durations of brushing?
5 minutes.
5.
Honestly, I don't do that too. Life is too short to brush. To be fair.
How long do you brush? 10 minutes.
I probably brush about 2 to 3 minutes while talking to my wife. Yeah, about 2 to 3 minutes lah. But 5 minutes that's research based. Some patients with very high decay risk, I ask them to put a timer there. 5 minutes. Because here's the thing, if you spend 5 minutes to brush, right, you are bound to cover every corner. You see that like, where else Really, honestly. You are bound to cover everywhere and probably do things 3 times. So you know what I mean? So yeah, 5 minutes, that's the recommended time.
Any recommended brand of toothpaste?
Not really lah. Colgate, Sensodyne, Dali, they're good. They're fine. If you have sensitive teeth, go Sensodyne or Colgate sensitive. One thing though, Systema. Systema is quite good. Yes, they don't pay me to this. They're quite good. Yeah, because the bristles are very soft. One, I don't know what 0. Toothbrush. 0.04. I think now 2. Yes, that's a new one now. It's like wow, they made it to 0.02 already. 0.02. And another thing is Systema toothbrush, the bristles, right? It's longer and the tip is finer. So you know that little space between your tooth and your gums, so 1 to 2 millimeters, it reaches there. So that's good. But another thing to control is the strength of your brushing. Don't brush too hard. If you brush too hard, you start to get cavities on the sides. That's what we call abrasion, because you're brushing too hard. Okay? Don't brush with vengeance. I always tell you, no vengeance. Another thing about electric toothbrush, I found that a lot of patients using electric toothbrush tend to have abrasion a lot, because when it's mechanically moving by itself, and then you move some more, you are going to get abrasion. Definitely. So if I see patients using electric toothbrush with abrasion, I always ask them to stop. Plus, it's more expensive. So, yeah.
Whitening toothpaste?
Whitening toothpaste, not really. Whitening toothpaste, it's a little bit more coarse. That's it. It doesn't whiten, it makes your teeth cleaner. But it also causes more abrasion. So whitening toothpaste, you know those cigarette toothpaste Zap? Yeah? They are coarser, they are rougher. And there's a problem there, it starts to wear out your teeth.
Amount of toothpaste to use?
You know the one where they show on TV, they want you to finish fast. Pea-sized.
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 Green pea.
Oh wow. Never thought of that.
Yeah, green pea.
Yeah, pea lah.
No, white pea.
Oh, okay lah.
Chickpea size.
Chickpea is a bit too big. No lah. Unless you really love it. But not necessary. The toothpaste, right? To be fair, it acts as an adjunct. It helps only. It's about the mechanical movement, actually.
And brush without toothpaste.
Can. I have done that sometimes when I go and I forgot to bring my toothpaste. Can, because ultimately it's the plug. That's the one you want to remove. That's it. You use the
brush.
Sorry?
Recommended times of brushing per day.
Twice a day.
Twice a day.
Once a day is good enough also. But that's for patients with very, very good motivation. But twice a day, average good.
Is it advisable to brush every time after meal?
That would be great if you can. It would be awesome. Yeah, but if you can't, then twice a day good enough, in the morning and at night. Because right, I'm gonna go a bit scientific now, so bear with me. Because right, the moment there's bacteria in the mouth, our mouth has a very specific pH. After you brush your teeth, there's a specific pH there. Alright? When bacteria was acidic, okay? If you brush your teeth immediately, that's great because it prevents the pH from going down. It stays there. Our toothpaste is basic, meaning it's alkaline. Alright? Alkaline is the contrast of acidic. Okay? So it's good. Now, if you can't, it's okay. As long as you, at night, when you brush your teeth, when you sleep, through, how many hours do you all sleep? 8 hours.
6.
When you have a baby, you don't sleep 8 hours. Okay, anyway, when 8 hours, that has ample of time for the pH to go down. So the moment you brush at night, when you sleep, before you sleep, it prolongs the pH in the mouth as basic. Got it? Now, why you need to brush when you wake up in the morning? Because through 8 hours, by the time you wake up, the acid would have gone, the pH would have gone down already. It's moving towards acidic already. So that's where you arrest it as well. So you bring the graph up again. So you brush some more. Alright, so that's the science behind why you brush twice a day.
So if you choose to brush once a day, is it morning better or night better?
Night.
At night?
Yes,
Okay.
because when you're awake, you eat. So you are supplying carbohydrates to your sugar. So at night, if you have to brush only once a day, then just at night. Unless you eat when you sleep. Yes.
Just now, with that little girl that drank
Swallow the toothpaste.
it,
Yes.
how does that make your teeth brown?
It's actually excessive fluoride. Now,
Excessive fluoride.
children are not supposed to use fluoridated toothpaste. That's the key. Oh, I think I didn't mention that, right? Children are not supposed to use fluoridated toothpaste simply because of the fact that they cannot speak. If they can speak, by all means use fluoridated toothpaste. Because fluoride, when you swallow fluoride, as an adult, if you swallow fluoride, it's fine because your teeth are all formed already. When a child swallows fluoride, the teeth are forming inside. So fluoride will then start to go into the teeth and start to cause brittleness. You start to see brown spots and white spots. Children's toothpaste, if you see all the Komodo dragon, right? Okay, they don't have fluoride. They're not supposed to have fluoride. But the problem is that the children's toothpaste, they make it very flavorful.
Yeah.
To a point that when we transition them to adults toothpaste, they like the flavor they swallow. So that's something we need to balance as a parent. Alright? Anything else? Very, very cool questions.
Like in the morning, I always confuse to brush teeth first or drink water first.
Whatever suits you, my dear.
It doesn't matter if you drink water
It
then brush
doesn't-
teeth.
it doesn't-
Drink all the bacteria.
You can wake up, have your breakfast first, and then brush. It's also fine.
Also okay.
Because you eat ready, then you supply your sugar, and then you brush, then you clean off everything.
It's better you eat than you brush your teeth.
You can
Someone
lah.
asked me to brush.
If you can lah. Sometimes you wake up like, oh my god, it's so disgusting. Then you brush. Yes,
Do you do braces?
I do. I do braces as well, but I'm very, very selective. Some cases are too complex. It requires major movements. Major movements normally I prefer.
Oh, you prefer major
No. I
Refer.
prefer. Please do this major case for me. Basically.
Okay.
Simple cases, yeah, straightforward, very, very easy. Yes.
How to encourage a small kid to brush teeth?
Parents
Show him
here.
all the pictures.
Usually, I see a lot of children. That question is equivalent to how, as a dentist, can I get the child to sit on my chair and open his mouth and take out his teeth? Basically, step by step. Start something simple first. Example: when the first time a child gets into my clinic, almost always they'll be afraid already. Most of a child, when they come into the clinic, their first impression is they're going to get a jab. Because from their past experiences, they are getting vaccinated. Alright? So when they come to the clinic, most of the time, my job is to make sure that the environment is comfortable enough and less scary. So most of the time, for my first visits, I don't do anything. I just talk to them and I get them to play with my tools. Alright? So in the toothbrushing scenario, introduce them the toothbrush, introduce to them the toothpaste. Very simple. The next visit, for my approach as a dentist, I always start with the simplest procedure. Meaning, I don't straight away go, I'm going to take off your tooth today. That's it. They're never going to come anymore. They're probably never going to come forever. Alright? I normally do polishing first. Take a brush and give them simple terms. Children can't understand, I'm going to do polishing. Children can't understand, I'm going to take this brush and brush your teeth. I always say I'm going to use a simple motorcycle, I'm going to use a magic juice, and I'm going to polish your teeth, clean your teeth. Polishing is one of the least scary procedure out there. One of the best things is that because it introduces the child to drilling as well. So the next time, let's say if I have to drill the child, that's alright. Let's say if I have to use the drill to clean the child's tooth, oh my god, then it's not that scary because they've had that experience before. Another important tool is whatever I'm telling you, right, these are all psychological ways to manage children. The other way is tell, show, do. Tell, show and do. Tell them, show them and do it. Meaning, when you want to teach them to brush, you show them how you brush first. And they get motivated to do it as well. And if they have an older sibling, get them to take part as well. Make it as a ritual. If you have a young child, a baby, always make a point to clean their mouth. Even if they don't have teeth. Take cloth, wipe on the insides. Because that makes them accustomed to brushing in the future. Alright? I have a 7-month-old boy, and every night without fail, of course because we're dentists, without fail, we take a soft cloth, we wet it, and then we wipe the gums and everything. And he used to not like it, and now he's like, it's okay. So it's a good exercise. And once they are older, they know it's part of a ritual. Every day before sleep, you need to clean. Then you transition from there. Alright? Keep it simple for them. Good. Thank you very much. You guys are awesome. Okay? Yo, yes.
So sometimes like while brushing we got like blurred. So what was that?
That's because swelling. You got dark swelling.
Swelling, but sometimes got.
No, when we talk about swelling, right, I don't mean that swelling, that kind. One of the telltale signs of gum swelling is our gums normally, they are knife shaped, alright, and they are pink in color. So if you see the knife shape has become more bulbous, and if you see it a bit redder, that's a sign of gum swelling already. A swollen gum with a simple touch will start to bleed. So when you brush, it irritates the gum a little bit and it bleeds. And that's because you have tartar and plaque hiding underneath. So when we do scaling, when you clean your teeth, you get bleeding, of course. And normally after 4 to 5 days, the swelling will subside. And then the bleeding will stop. Alright? Yes?
Any special rate in people?
I knew we would come to this. Basically, what I always do is I've done a few talks here and there. So places that I've been to, employees, let's say employees of Flexi Room, if you come, tell me you're from Flexi Room, we'll give you 10% off your entire receipt. Basically, it's to number one, promote the clinic so that they will come. Secondly, it's also to get you guys exposed to dentistry lah. It doesn't mean that you have to come to this dentist. You can go to any other dental clinics as well, but the best is to this clinic lah. But if you can,
Just take louder,
go visit the dentist. That's my end point lah. It will be better here lah, but you can see. Alright? Alright, cool. Have a great weekend, guys.